Today is the second video of this 10-part series about metacognitive therapy. In each short video, we cover a concept or tool that's commonly used in metacognitive therapy. In this video, we're going to look at trigger thoughts, which is one of the key concepts to understanding the process in metacognition. So trigger thoughts are specific thoughts or mental images that initiate a chain reaction of negative thinking and emotional responses. These thoughts are called triggers because they can set off a cascade of cognitive and emotional processes. These can lead to excessive worrying and rumination, often leading to symptoms of anxiety or depression. Unlike general thoughts, trigger thoughts have a significant emotional impact, and they're often linked with our core beliefs and past experiences. Now, it's important to note that trigger thoughts are different from automatic thoughts, which we often talk about in cognitive behavioral therapy. They're more like the initial spark than a deeper belief system. We can think of it like the domino effect, where the trigger thought is the first domino to fall. And from that point, just like we'd see more dominoes fall, keep seeing more thoughts escalating and building on top of each other. So trigger thoughts are often automatic and subconscious. We differentiate between external and internal triggers, which can both spark trigger thoughts. So an external trigger is either an event or a situation that happens around you. An example of an external trigger can be hearing the notification sound on your phone, indicating that you received a new email. You check it and see that it's from your boss. It's labeled urgent and it's sent outside of normal work hours. This external event may trigger a thought of it must be something serious, and from there we might start to engage in worrying, having thoughts like, what if I made a mistake? And like that, our thoughts can keep snowballing until we fear that we're going to lose our job. Sometimes a notification sound or a phone ringing in itself can be enough to trigger that line of thought, before we even know if it's urgent or important. Internal trigger events, on the other hand, can be either bodily sensations or other thoughts. A bodily sensation like having a headache or a stomach ache may be a trigger thought for health anxiety, leading us to fear that we have a serious illness. It can also be that we simply think of something that acts as a trigger and leads us to worrying or ruminating. This is most likely to happen when we either think of something that's important to us or something that could be a problem for us or a potential threat for us. For example, a seemingly positive and happy thought like, I love my house, might lead us to worrying about losing our jobs, not being able to pay our bills, and ultimately losing our house. And just like that, we can build up a catastrophic thought, all set off by a single trigger thought. Regardless of the content, trigger thoughts are a normal part of the human brain. The brain produces around 70,000 thoughts every single day, and roughly 3,000 of those can be considered trigger thoughts. This thought generation is part of an automatic and subconscious process that we can't control. In other words, we can't control what trigger thoughts come into our mind. They're impossible to avoid. So we're not responsible for having thoughts that we don't like. We're only responsible for how we react to those thoughts. Either we pick them up and worry about them, or we let them go. If I were to ask you how many of the 70,000 thoughts you had yesterday you remember today, it probably wouldn't be very many. But the thoughts that you would likely remember are the thoughts that you gave attention to, the thoughts that you held on to and kept expanding on. You see, most of the thoughts we have in a day will simply enter our mind and go again without us doing anything about them, unless we give them attention. And that's one of the things at the core of MCT. We cannot control whether a thought strikes us, but we can control what we do with the thought after that point. So in metacognitive therapy, the focus is not on avoiding trigger events or trigger thoughts. That would simply be impossible, and we need to accept that triggers and trigger thoughts are part of life. So instead, metacognitive therapy focuses on changing what comes after the trigger thought. In metacognitive therapy, we aim to do nothing with the trigger thoughts, apart from acknowledging them, accepting them, and letting them go again. Now, it can be really difficult to not do anything with our trigger thoughts, partly because of our metacognitive beliefs, which we'll cover in the next video, but also because doing nothing with our thoughts and feelings seems counterintuitive and often doesn't come easy to us. We live in a world that reinforces self-improvement, and often that requires hard work. So most of us live in a constant state of doing, trying to become better versions of ourselves. We self-improve, read, learn, teach, create, and so on. Doing nothing, on the other hand, is often associated with being lazy and can trigger negative feelings in some people. We also tend to attribute too much importance to our thoughts and ultimately pay too much attention to them. But a really important key concept of metacognitive therapy is that thoughts don't hold any meaning, and they definitely don't dictate our actions. But understanding and being able to spot these trigger thoughts is crucial in order to be able to break the cycle of them leading to excessive worrying and rumination. When you start to become more metacognitively aware, that is when you start to realize what you do with your thoughts. You also realize that you have a choice when it comes to your thoughts. You can choose to let the trigger thought develop into long speculations, or you can choose to acknowledge that the trigger thought is there and then do nothing more. You deal with the thought with what we call detached attention. Once you start to perceive your thoughts in this way, you can start to change your thinking habits and you can free yourself from negative thought patterns. This is the point where you can start using different techniques from MCT, like detached mindfulness and attention training technique. We'll cover both of them in later videos. But before we get to the techniques, there's a few more foundational concepts that we need to get to grips with. As we talked about in the first video of the series, awareness and understanding of the thought processes is a crucial aspect of MCT treatment. So in the next video, we're going to cover metacognitions and metacognitive beliefs. Make sure that you're subscribed and you have your notifications turned on to not miss it. I upload new psychological insights, tips and tools on this channel every week. I'd always love to hear if there's any psychological topic that you'd like me to cover. Let me know in the comments. Thank you for watching this one. Take care and bye for now.